My name is Anna Winters, and I'm the co founder and CEO of Akros. Imagine if the power of space could be put in the hands of health heroes taking life saving health services to the last mile in Africa. I've spent the better part of my global health career in Zambia, a country in southern Africa. Zambia is modernizing quickly. Many residents have cell phones and connectivity is growing. But even so, you'd find that only 10 kilometers out of the capital city of Lusaka, and you're in the village, living on dirt floors and with very limited education and subsistence living. And that can be said for the majority of the country and even across much of Africa. Even amidst the modernization that's happening in Zambia, preventable diseases persist. HIV, malaria, diarrheal diseases, these all take massive tolls on the community, whether it be lost days to work and school, high mortality rates, and economic tolls. And these diseases are preventable and treatable, with effective treatments commonly available. But even with the availability of treatments, often the challenge is knowing where people live in order to get these life saving interventions to them. One of the main challenges is we just don't know where everyone lives. Rural and even urban communities have no address systems, outdated census data, and mobile populations are common. And if we don't know where everyone lives, those health services just won't get to them. But now we have the tools to change this. With Earth observation and satellite imagery now so available, we're able to map and understand where people live so that community health workers can navigate to unreached communities and households and ensure that everyone receives critical health services and that they're not missed. A main goal at Akros, the organization which I co-founded and serve as the CEO, is ensuring that health services are accessible to everyone. We are pushing the envelope when it comes to making the power of Earth observation accessible and contextual to local field teams in Africa and Asia. In partnership with ministries of health and local teams, we developed a digital global good called Reveal. Reveal brings the power of space to the hands of local actors to lead data-driven surveillance and critical service delivery. Heroes of community health who walk miles to deliver health services to rural areas carry the simple yet groundbreaking tool with them to navigate to rural communities and ensure that life-saving health services are delivered to all. We've seen a significant impact through our work, the kind of impact that is rare and exciting in the field of global health. 2.5 million new users of sanitation over 36 months. Reduction of malaria prevalence from 30% to 4%, and all with a significant return on investment figures. Certainly, these are impressive numbers, but the real wins are what those numbers mean for each person whose life has been positively impacted. Fewer school dropouts or missed work days due to sickness means financial security and education gains. Access to latrines, soap, and water mean less diarrheal disease and child stunting. These wins are personal and they're for real people. Their lives are improved and paths out of poverty have been created. These innovations and deployments have been rooted in an understanding of local context. They've addressed salient issues, and they've contributed to bringing health and well-being to those in need. Now is the time for innovative partners to work together so that the incredible power of tech reaches every person on this planet that need life-saving health interventions. We are excited to work with new partners and in new countries to build on our learnings and to continue to accelerate impact in new ways. Together, let's bring the power of space and data to global health.